How would you take care of an old sick person in your home? Contrary to popular belief, a hospital is not necessarily the best place for a sick person to be. In fact, even doctors sometimes advise that an old sick person be taken care of at home, amidst familiar surroundings and among those he or she loves. There is even reason to believe that the home environment can have a therapeutic effect on the sick person. But taking care of a sick person, especially an old sick person, is no small task. Also, it does not make sense to get a group of medical people to stay with the sick person to take care of him or her. Such a measure is very expensive and may not be affordable to many. First of all, the room in which the sick person is to stay must be quiet and peaceful. He must have a room to himself. Depending on the sick person, the room should have temperature control facilities. The room must be well ventilated and pleasantly painted and decorated. Probably known to all of us, visitors must be controlled. This is why hospitals are so fussy about visiting hours. Visitors must be controlled even at the displeasure of the sick person. Often it happens that visitors strain a sick person. However, it would not do to be tyrannical and over-control the visiting hours. A doctor's advice is useful to determine how the visitors are to be controlled. In fact, there may be certain cases where the doctors will actually advise that the sick person should have no restrictions on visitors. Food too must be catered to the sick person according to doctor's orders. The sick diet must be followed. There is a likelihood that well-meaning visitors will bring in forbidden food, some will even sneak it in. Strict vigilance is necessary here. Medicines prescribed by the doctors must be administered according to the timetable. If possible, one person must take total responsibility for the patient and the others must take instructions. Too many people getting involved will end up in confusion. Finally, we must be careful not to pamper the patient. Too much care might actually spoil the patient and may end up with him refusing to get well. He could very well, perhaps not consciously, like to remain sick and enjoy all the attention he is getting. The care given must be what is required and not more than that. So we see, taking care of a sick person is a big responsibility and not an easy one.